Everyone, I want to talk about something that could potentially save you time, money, and pain. When you wake up injured, or you slip and fall, or you play a sport and get injured, or you work out and you're sore. In my 20 years of experience, I've seen a lot of people have those types of situations where they started off going to the emergency room. Videos not to discredit the value of the emergency room or the hospital, but it is to shed light on the inefficiency of the emergency room and the hospital and the high costs associated with doing so, and the lack of treatment often associated with doing so. Typically, most injuries aren't broken bones. Most people don't suffer big gaping wounds. That's not the reason most people are going to the hospital. But if that is the case, certainly end up going to a hospital, right? Get, compound fracture where the bone breaks through the skin. Broken bones usually aren't too secretive. They reveal themselves. A lot of people end up going to the hospital, waking up with a stiff neck, fall or something, hurt their low back. And there's really no treatment that comes from that. Even the imaging taken at a hospital usually isn't too productive. It isn't conclusive. Typically, you're going to get a lot of testing and very little treatment. When they do take an image, they're typically looking for a break. Breaks usually aren't that hard to detect. Very severe things are typically what the emergency room is looking to rule out, and that's the right thing for them to do. They don't have much expertise in restoring function, decreasing inflammation, and getting rid of the cause of your pain. They can usually detect where it's coming from if it is an overt break or some kind of tumor. But if it's a functional issue like an athletic injury or some kind of slip and fall in your low back, the best advice you're typically going to get is go home, take Advil, take ice, and rest, which doesn't fix you. So many patients have come to see me over the last 2 decades after they've rested for the 2 weeks of an injury that the hospital told them, oh, well, you're okay. But they weren't okay. They can't function. So how are you okay if you're in pain? And how are you okay if you're not functioning? And how could you go into a situation with a physical injury and leave without any physical treatment? To me, that's always kind of blown my mind. But if there's a part of my body that is physically injured or physically compromised, and you send me out with a piece of paper, I don't feel like I was treated at all, because this is a physical problem. There needs to be some sort of physical intervention to restore the mechanical deficit that my body is currently experiencing that's causing inflammation, that's causing muscle spasm, causing pain. So a good idea would be to go to the chiropractor, right? Because we're very well trained at identifying breaks, identifying things that may be coming from a tumorous lesion. These are the minority of cases, and the hospital is useful in that situation. But if you wake up with a stiff neck, you don't have an Advil deficiency, which is pretty much going to be your treatment when you go to the hospital after you wait 4 hours and they do all the testing that your insurance would pay for, and then they tell you to go home. And everything's inflated, and that speaks to our sick care system with absorbent amounts of testing, very little intervention, very little treatment or cure for anything. So that's more the point of this video, is to let you know you're not really going to get treated with a solution in most emergency situations for a musculoskeletal injury, which is a large reason people go to the hospital. Make sure you've ruled out the worst case scenario. But once that worst case scenario is ruled out, now what are you going to do, right? Now you're just going to go home and rest and hope it fixes itself. Maybe it will. Usually it doesn't. And then how long are you willing to stay down and out of action and dysfunctional until you're ready to feel better again? When someone wakes up and they come to my office, they leave feeling better that day. I can't tell you how many patients I've seen go conventional route, and then maybe one of our patients has referred a friend, a family member who's been injured. They come in here and they get acupuncture, get adjusted, get massaged, they get herbal supplements for their inflammation and for their spasm and to calm the nervous system. And they leave like, oh my God, I wish I came in here when this initially happened. Had they known better, they would have. But there's not a big system pushing people into the cure and resolution-based medicine. It's usually sick care-based medicine. I use that term sick care because you're leaving a hospital with zero treatment, but like a $20,000 bill for a test that showed really nothing. Did you break something? Is there a tumor? There's a lot of other things that can happen to your spine, to any joint in your body besides breaking it. When you look at different x-rays, the way chiropractors look at an x-ray, we're looking at function, a lifetime of dysfunction perhaps, or an acute dysfunction, a subluxation of a vertebra, displacements, changes in curvature, decreased range of motion tell us a lot about your function. Dropped hips on one side, even if it's not a traumatic situation and it's some gradual onset thing that you wake up with, your x-ray is going to explain that, because chiropractors are trained to assess imaging in that way versus the hospital, which is like, oh, you have no curve in your neck, you're full of arthritis, there's disc degeneration, and they're like, oh, it's normal for your age. Normal for your age? That's crazy, right? Is it normal for your teeth to start decaying and falling out at the age of 40? I've had so many patients come to me like, they took x-rays, they said there's some degeneration, but it's normal for my age. No dysfunction in your spine is normal. As common as it may be, it's not normal. If you went to the dentist with 5 cavities in your 40s, would he say that's normal for your age, or would he say you have terrible dental hygiene and you need to start taking care of your teeth? Your spine is no different than that, right? So for the medical community to constantly pawn off spinal dysfunction is normal for your age would be another reason I would stay clear of it when I do have a spinal injury, because you're going to show most likely some dysfunction that they're going to say is normal. Common and normal are not the same thing. It's never normal to be dysfunctional and full of arthritis. You're full of arthritis, you probably have some kind of metabolic insufficiency. If we see bones on an x-ray that are all deformed, your diet could not be good, or you've had severe traumas over the past that haven't been resolved that caused mechanical problems, and now you're having friction in the spine and you're wearing out. But if the spine is aligned properly and we still see all this deterioration, you're nutrient deficient, right? Because the first place your body is going to start pulling nutrients from when you're nutrient deficient is your bones. Your bone is the reservoir for nutrients, and when you're not eating enough of it, your body's going to steal it from your bones. That's another example I've seen thousands of times in 20 years. Everyone was told it's normal. It's sick care. That's why I use sick care all the time. You're showing up sick. They can't tell you why you're sick, or they don't care to tell you why you're sick, because they've done so much diagnostic testing that the reimbursement for all the tests they ran far outweigh them telling you to eat better, hydrate, and get adjusted. If you follow the money, you'll understand why it's probably not in your best interest to get garden variety, low back pain, neck pain, stiff shoulders, stiff elbows, stiff knees examined at a hospital, because they're not really interested in whether or not you're going to get better. They're more interested in how much can they run the bill up for that initial visit and get reimbursed. That initial visit at the hospital to have this stuff checked is going to be like in the range of probably 20 times what it cost you to fix it over 6 to 8 weeks at a chiropractor's office. It's skewed because of the way insurance reimburses things. Even if you went out of pocket, the cause of your problem treated by a chiropractor, acupuncturist, versus zero treatment, a ton of testing, zero relief. Be proactive in your health. Try to avoid the sick care system. If you go into a chiropractor or an acupuncturist office and you have a broken bone, chiropractor is probably going to be able to identify if the bone is broken. You got to get it taken care of. And then we talk about how do you heal the bone, right? So like, just because you break a bone doesn't mean there's no treatment. You need more nutrients, more circulation, more flow, right? So the chiropractor, at least me, I'm not going to sit there and start manipulating the broken bone, but I'm going to make sure the blood supply to that bone is increased during that time of need. We're going to give proper nutrients, minerals to repair those bones and the cofactors for collagen synthesis. I'm going to do acupuncture surrounding the area to flood it with blood flow to get it to heal, right? So there's so many different ways to help the body recover from different musculoskeletal injuries, and it's so much more effective. And I've seen thousands of patients waste time getting a barrage of imaging and zero treatment. Testing sounds good, but a test without an answer, without a treatment plan, is really just kind of a racket, in my opinion. You could start treating someone in 2 weeks and they could be better, and maybe you don't even need the test at some point. I understand the fear. Fear is what usually leads to people submitting to an enormous amount of testing, and also the fact that your insurance covers it. If your insurance doesn't cover it, you're definitely better off going out of pocket for a solution-based care that I'm suggesting in terms of chiropractic, acupuncture, massage. Those are solution-based. Your insurance has covered everything we're going to do here. So go home and be in pain and take Advil. You wake up injured, you fall, you get hurt. It doesn't always have to be the emergency room. This is not to discredit what medical professionals are doing, rolling out severe traumas. A severe trauma, I would think most people have the discretion to know it's a severe trauma and you need to get to the emergency room, like a car accident, right? Like maybe you think you broke your leg. Certainly, those are good places to start. If you're unsure, chiropractors are going to order the testing that the hospital would order anyway, and probably not as much testing unless the testing is appropriate. to run a bill up sky high and then telling them to go home because what they have is normal. If you're in pain, it's not normal. So remember that. Your pain's not normal. Thanks, guys. Be well.